I'm going to share with you some obviously both international and what we did at our hospital as well in terms of this PPE shortage, because every country worldwide suffered some sort of shortages when it comes to PPE, whether it's gowns, masks, and it was a challenge for every country, including Malta. Now, unfortunately, nurses who are the frontliners, we had a number who died, and now when I say 2,200, all right, which was reported by the International Council of Nurses, this is just less than a quarter of countries globally. The number is bigger than this, and unfortunately, these nurses lost their lives during their duty of care. Just note how it is transmitted, COVID-19. I'm sure that everyone heard, but I would like to go through them very quickly. First of all, coronaviruses, which besides COVID-19, there are other coronaviruses circulating in the community. They spread through respiratory secretions, and they're not spread through blood, feces, sweat, or other fluids. Mainly, they are transmitted from person to person, either through droplets, that means from coughing, sneezing, they fall on the face, and being inhaled or transferred to eyes or mouth. And also, it can be transmitted through contact of bare hands, that you have contaminated respiratory droplets on your hands, and that's why hand hygiene is one of the prevention, all right? Not only COVID-19, but in other infections. And then what happens? You touch your own mouth, nose, or eyes without performing hand hygiene, and you become infected. The third one is through airborne, right? And these we refer to them as aerosol generating procedures. And these are some examples like manual ventilation, intubation, non-invasive ventilation, or tracheostomy insertion. Now, and the question is, how can healthcare workers get infected? Our experience with other infectious diseases show that the greatest risk is when doffing, removing PPE. And as Rebecca highlighted, we concentrated very much on training, because it's not only the availability of PPE, which is important, but training is it's also important as much as having PPEs. And from our experience, and even when we consulted with other teams, one of them is based in Liverpool, which they cared for patients, for example, with Ebola. We have learned that the more complex is the PPE, the greater is the risk of self-contamination during doffing. And therefore, the choice of PPEs, and not only in our hospital, but even other hospitals worldwide, we try to keep the PPEs as simple as much as possible, so that when they remove them, right, the chances of becoming infected, which would be much less than using these highly specified, for example, body suits, Tyvek suits, which we have seen on media as well. Now, these are the PPE which we are using in our hospital, and I also believe that these are being used in other hospitals worldwide. They are PPEs which we were using before. It's a surgical mask. You have an N95 or FFP2 or FFP3 masks, all right, which are used for aerosol generating procedures, the visor or goggles, the gown, apron, and gloves. These are very simple PPEs, which we are very familiar with them. Even the healthcare workers, they were already familiar. Therefore, when it came to training, it was much simpler than using these, as I said, highly technological PPEs, such as the Tyvek suit, right? Those are with the hoods we see on the media, Now, masks, we know that they reduce airborne transmission. On this slide, you can see that if the infected, all right, person, even if he is asymptomatic, he can spread the COVID-19 if the other person is not wearing a mask. But if both the infected person and the other person are wearing both the mask, you have minimum exposure. And this is what we managed to convince even our healthcare workers, that a surgical mask, all right, will reduce this airborne transmission. Now, when it comes to shortage of PPE, these are some photos that I found on the internet. We can see that various countries are struggling, right, with getting hold of these PPEs. In fact, you can see one of the photos, it was in the UK, the nurse, you can see, she's wearing a garbage bag because they ran out of these gowns or aprons. Now, what are the main reasons for PPE shortage worldwide? And there are two main reasons. First of all, almost half of the world's masks were made in China before the pandemic. And also, many component pieces of surgical and N95 masks were sourced from China, so non-Chinese manufacturers had difficulty procuring the necessary supplies to continue production. And also, before this pandemic, getting hold of these PPEs was quite easy. However, with this high demand from each country worldwide, even even China itself and the other countries couldn't cope with this high surge of need for these PPEs. And this is one of the papers where from this study, all right, it was a survey, sorry. From this study, it came out that eye protection, 1 in 5 members of states did not have access to this. And 24% had bought PPE independently to go to work due to lack of supply. They had to buy their own PPE because there was no PPEs available in their hospital. Now, how can we make the best use of PPEs, especially when there is a shortage especially during these aerosol generating procedure? Because this is when you have an aerosol generating procedure, you are much more at risk, right, of getting infected with COVID-19 and even other airborne infections, for example, such as TB, measles, chickenpox. Now, in our hospital, we set up a policy, for example, for these aerosol generating procedures to guide our healthcare workers to what PPEs they need to wear for the specific task, all right? And this is showing, for example, if the patient, let's take the first column, if the patient has symptoms are absent and the latest COVID-19 swab result is negative, then PPEs, they need a surgical mask, SM, apron, gloves, and a visor. He doesn't need no single room and normal ventilation. However, if there are symptoms and he's positive, then you need an FFP3, the last common, as you can see here, gown, gloves, and visor. And the room, it has to have a negative pressure, all right, with a 6 to 12 air changes per hour. We did these guidelines so that we make the best use of these PPEs, because it's easy to give to all healthcare workers, for example, these N95 masks, but once you run out of these N95 masks and we have these aerosol generating procedures, we don't have nothing to give to our healthcare workers. And this is also another part of our policy when you have a continuous aerosol generating procedure. For example, we have a patient, all right, who has a tracheostomy and has continuous suctioning. Again, this is a guideline, right, to guide our healthcare workers to what PPEs they need to use in that specific situation. Now, if we look at the slide, the SHEA in the US, they did a research network hospitals during the COVID-19 pandemic, and they had a 73 response rate. And from this survey, it came out that 52% of respondents reported that they wore the same respirator for one day, and when not in use, it was stored in paper bag. Regarding self-producing, respondents wrote that they were self-producing PPE due to shortages, including face shield, eye shield, gowns, surgical mask, and coveralls. Regarding reprocessing, nearly half of the responding facilities indicated they reprocessed respirators using hydrogen peroxide, UV irradiation, or ethylene oxide. As you can see, because of this shortage, every country tried to find a solution, all right, to either extend the life of these PPEs or else find other alternatives. Now, the ECDC on the 3rd July of last year updated the PPE's reuse in view of global shortage. And basically, they said that the same respirator may be used while caring for multiple patients with COVID-19. If you have a 6-bedded patients or with COVID, you can stay with the same respirator with those 6 patients. Several different procedures have been tested, example, ultraviolet disinfection, which we are using in our hospital. And also the CDC recommends limiting the number of donnings for a respirator to no more than 5 times per device if you're using UV. And also this procedure is now approved by both the CDC and NIOSH as well in the US. These are the in-house made UV boxes that we did at our hospital. Today, we have improved them. They are made of stainless steel. They are much better. But we are using these boxes to reprocess, especially these N95 FFP2, which we use for aerosol generating procedures. We have tested these boxes. We have tested the mask. And this UV will kill any droplets of COVID-19 or other microorganisms. And the last slide, which I will end up, is that in November of last year, the CDC issued another update. And in this update, they said that the face mask should be discarded whenever the face mask is removed, and also at the end of each workday. Also, the face mask should also be removed and discarded if soiled, damaged, or hard to breathe through. And thirdly, healthcare professionals must take care not to touch their face mask. Right? This is very important. It was highlighted in our training that when they doff, when they remove the PPE, they don't touch the front part of any PPE, face mask, apron, gown, whatever. If they touch or adjust their face mask, they must immediately perform hand hygiene. And lastly, I would like, and with this photo, which was taken by our colleague of 2 nurses in intensive care, this is a photo showing 2 nurses saying a prayer before entering the room where they had patients with COVID-19. And proudly, I have to say that the WHO has chosen this photo to use as a Christmas card to send to all countries last December. Thank you.